We will continue to talk about the mental health with the Chinese athletes. Our next speaker, and for me it's really important because I know the tenacity of the mental of the Chinese athlete opponent in fencing. So I will take my note for this intervention. So please, under your applause, he is on video, Gangyan Si, sport psychologist at the Hong Kong University. Hello.
Hello. Can you see me?
Yeah, it's perfect. It's your turn.
Okay, thank you. Good afternoon from Hong Kong, everybody. Ladies and gentlemen, I'm Gangyan Si from Hong Kong Sports Institute. My topic today is a management framework of the Chinese elite athletes' mental health. So there is increased research during the past 10 years regarding the mental health of Chinese elite athletes. So that's including not only the quantitative investigation regarding the Chinese athletes' mental health management, as well as the qualitative researches, case studies about the individual athletes' depressions, even the committed suicide thoughts of elite athletes. So this is a quite a popular topic in China now. China is a quite big country and with quite many athletes. For example, this year, 2021, we have national games. So there are more than 14,000 Chinese athletes come from 35 provincial level delegations joined these national games. So this does not include the professional sports clubs athletes, does not include the university student athletes and disabled athletes. So a major concern now is that there are only a small number of athletes, mental health management worker had been carried out at the national and the provincial elite sports training center in China. So we would like to propose a sports training center based mental health management worker for Chinese elite athletes. So you're probably asking me why we should develop such kind of management framework based on the sports training center. So this is because of related to the characteristics of the Chinese sports system. Chinese sports system is quite different from that of the most Western countries. So almost all of Chinese elite athletes, they are not only trained in the sports training centers, but also they live there with 24 hours a day and 7 days a week. So this is a main character from what we call the whole nation system, fully sponsored by Chinese government. The second feature of Chinese sports system is there is always a science and technology department within each of the Chinese national or provincial sports training centers, and which also include a sports psychology unit. So there are sports psychology staff there, so who can be responsible for taking care of the Chinese athletes' mental health management. Considering the aims and the structures of the existing mental health service and the management recommended by International Olympic Committee, and we also take care of the mechanism of the Chinese sports system. So we would like to propose a training center-based mental health management framework for Chinese athletes, which includes 3 aspects. So the first aspect is annual mental health screening. And the second one is follow-up worker and the mental health emergency interventions. And the third aspect is the mental health literacy education. So let's say the management framework we proposed. So as I just mentioned, there is always a science and technology department within the provincial or national sports training center. So the mental health management worker could be coordinated by specialized task force or persons at the sports training center. So my presentation today, I will mainly talk about the management worker from the provincial sports training center. So this framework includes three sections, or we say three aspects. The first aspect is annual mental health screening. So it includes three steps. So first step is a two-dimensional mental health screening. So which two dimension we actually means the positive dimension and the negative dimension. So of course, for the negative dimension, we refer to the psychopathology dimension. This is the traditional dimension. And for the positive dimension, we refer to the subjective well-being and flourishing dimension. Now we are developing a questionnaire for those positive dimension aspect. The second step is for athletes meet cut-off criteria in mental health score, and they are be further interviewed. And the next step is, yes, we do referral to those athletes who exceeded the cut-off criteria to external hospital for the psychiatrist, and we also do the follow-up work with other athletes. Then the second aspect, the main worker is the follow-up. So also three steps. First, the follow-up athletes with the mental health risks. And second step is the link up with athletes' career development. Yes, we have found a very interesting connection between the athletes' mental health aspect and their career development plan. So the next step is deal with some mental health emergencies. This is also a content belong to this aspect. The third aspect within our mental health management framework is the mental health literacy education. So we can do the structured education program and also the single lecture or seminar, also the online or printed publicity and the consultation workers. So those are the three aspects. I will introduce them one by one. Here is a brief description of the first aspect. So the annual mental health screening. Step one is the screening worker for all of athletes from a specific sports training centers. Step two, for the athletes with negative mental health, they exceeded the cut-off threshold, we will do the follow-up worker. And step three, for the athletes who are assessed at the high risk, we do referral work to the psychiatrist in the outside hospitals. And we also take care of the other athletes. So let's see a concrete example to show this mental health screening worker we have done. So this is an example we have done last year. The G province is located in south of China. So this provincial sports training center has a rich resources to provide them this mental health worker. Part of the purpose for conducting this screening last year in July is we want to evaluate the impact of the lockdown on athletes' mental health. So as I just mentioned, this province has a very good resource to organize a mental health team. So the mental health team consists of one full-time central-based psychological consultant who has been trained in both counseling psychology and sports psychology, and 3 part-time certified sports psychology consultants, and with 1 part-time professional serving as a leader of the team. There are also 2 master's degree students majored in sports psychology as a helper. And one very good advantage of this team is this sports training center also has a task force for elite athletes career development planning, so which consists of 2 part-time psychology counselors. So you see the situation now for this mental health team, which provide this management worker, consists of at least 8 staff. Okay, let's see the concrete situation from this example. So during step 1, the mental health team screened 700 elite athletes by using SCL 90 inventory and found that approximately 11% of all of athletes showed moderate to high levels mental health disorders. So that means exceeded the cutoff scores. So you can calculate. So 11% of the 700 is around 77 athletes. Okay, during step 2, we further assessed those 11% of athletes individually. We face-to-face interview, helped by some skills like self-rating anxiety skill, self-rating depression skill, or eating disorder skills, okay, those kind of skills. So using a standard procedure developed by the mental health team, each athlete was interviewed and evaluated by 2 psychology professionals. So the all of situations could be divided into 3 different levels. So high risk level, middle risk level, and the low risk level. So you'll see the results here. The interview resulted 3% of these 77 athletes belong to high risk athletes. 15% belong to the middle risk athletes, and the 82% of athletes belong to the low risk athletes. Okay, so the concrete number, you can calculate that. So 3% of 77 is 2 athletes, and 15% of middle risk athletes are the 12 athletes, and the 82% of athletes is 63 athletes. So during step 3, we made the recommendations to the training center's management. So we do referring, we're referring high-risk athletes to the psychiatrist in outside hospital. And for those 2 athletes, they receive the further diagnosis and the treatment. So this is like 3 steps we have carried out last year as an annual mental health screening. Okay, I hope I explained this process clearly. So you are watching and listening my report right now. I guess some of you probably want to ask me the question. So why don't you use the sport mental health assessment tools recommended by IOC, which published last year in the British Journal of Sports Medicine? So this is a very interesting question here. So I would like to share some information with you if you are interested in IOC recommended assessments and if you are familiar with these assessments. So according to the process, procedure recommended by IOC mental health working group. So there is a skill they call the triage skill. That is athletes psychological strain questionnaire. So APSQ with 10 items. So the cutoff criteria for the APSQ is 17 score and above. So this is a cutoff recommendation, cutoff criteria recommended by the IOC. Okay, so this year in 2022, we implemented the second annual screening at the same sports training center with 620 athletes. Okay, 620 athletes. So can you guess how many athletes who scored 17 or above by using the APSQ, which recommended by IOC? So the answer is 50% of athletes, not 15, 50% of our athletes who did this screening, they got score equal or above the 17. So you can understand the situation. It could be difficult to imagine so many athletes have those psychological problems. Okay, so that means we need further validation for the questionnaire. Then we used another 2 questionnaires recommended by IOC. So one is the general anxiety disorder. Another one is the patient health questionnaire. So 2 questionnaires also recommended by IOC. One is depression, one is anxiety. So by using those 2 questionnaires, the most athletes who scored over 17 by APSQ questionnaires, so they got a score from these 2 questionnaires at the low risk level. So you can say this is not consistent between the triage questionnaire and the next phase recommended by IOC, the questionnaires. Well, at least we can see the current situation is the triage questionnaire is not so sensitive to detect the athletes with the mental health situation. Okay, this is like a general information I would like to share with you. Okay, let's continue from my report here. Now we come to the second aspect. That means follow-up worker from our management framework. Well, there are 2 aspects for the follow-up worker. So first aspect is for those athletes with mental health symptoms that are below the cutoff criteria. Then the second aspect for those athletes who are diagnosed with the mental health disorder, for example, depression, bipolar disorders, and eating disorders, and they got treatment, diagnosed treatment from outside hospital, and they returned to sports training center. Okay, so we should take care of those athletes. So, well, I would like to continue our situation last year. So still remember, we have 12 athletes at the middle risk level. So for those athletes with middle mental health risk at the sports training center, our mental health team continue to follow up with them for 4 weeks. So during these 4 weeks, we provided the consultation and observational assessment at least once a week. And at the same time, we gather the feedback from the coaches and from the team medical staff. So in Chinese team, each team have what we call the team doctor there. And as a result, after these 4 weeks, the mental health symptoms for 2/3 of those athletes gradually disappeared. And for another 1/3 athletes, their mental health symptoms did not disappear, but at the same time, they did not get worse. So therefore, they were continuously monitored to prevent the condition getting worse. Then the second aspect, for the high mental risk athletes who were diagnosed with mental health disorder by the external hospital psychiatrist, they received treatment from the hospital, and they were released from hospital and returned to the sports training center for 4 weeks without having joined the training and competition, if any. So the mental health team at the sports training center continued to maintain the communication with the hospital psychiatrist concerning those athletes. So those is the work, the follow-up worker the mental health team did. Okay, the third aspect from this management framework is the mental health literacy education. Our team conducted a mental health literacy intervention for elite athletes at another province sports training center. So this is another sports training center. In the winter training period from December 2019 to the January 2020. Okay, so the total of those intervention athletes is 60 elite badminton and table tennis athletes. So 35 male and 25 female athletes we included. We used the RCT design and carried out this intervention. So the results, the findings demonstrated that the intervention significantly improves athletes' mental health literacy, helping seeking attitudes and the intentions, as well as reduce the stigma in both post-intervention and the follow-up tests. Although there were no significant intervention effect on athletes' help-seeking behavior at both post and follow-up tests. But anyway, this intervention demonstrates that the center-based mental health literacy intervention for Chinese elite athletes is feasible and can be integrated into the management framework. Well, for this literacy education, we can use different steps here. Okay, come to my conclusion. So I just introduced our recently developed mental health management framework for Chinese athletes. And we have also applied this framework at 2 provincial and high performance training centers and with satisfactory results. Well, further studies should consider expanding this scale of the implementation and nationwide at the increasing number of sports training centers and to test its feasibility and the effectiveness in different contexts. Okay, I finished my presentation here. So thank you very much for your patience.
Thank you. Thank you very much, Gangyan Si. Is there any questions in the room? Yes? It's coming.
Hi, konnichiwa, Gangyan Si. Paul Willeman from Belgium. He doesn't know me. That's probably the reason.
Oh, yes, Paul, I can hear you.
Thank you. Gangyan Si, I want to support you in the fact that IOC Medical Commission has made a first step to look at mental health and propose some tools. But some of those tools are only just developed, and some of them are not strong enough in comparison to the classical clinical and psychological tools. And I get a thumbs up from a colleague from Sweden. So in that sense, I think it's important for us. It's more not of a question, but it's more of a statement that we as specialists also provide feedback to the IOC that their instruments must be much stronger and perhaps other instruments are available. The question now I have for you is, for those athletes who were referred to external hospitals, psychiatry, would you feel it more important that you have your own psychiatrist to work with, or is it more important to work with local clinics or local psychiatry sections?
Thank you, Paul. Yes, I just want to give a short response to your question. First is about the IOC assessment. Yes, we also translate IOC assessment into Chinese under the Chinese cultural background. I think this is a very important step to adapt using those IOC recommended assessment. Okay, so this is my impression and what we have done to further to use by IOC recommended assessment in Chinese cultural backgrounds. Well, to answer your question, Paul, I think this is according to the conditions in China now, we cannot have our own psychiatrist, what we call a sport psychiatrist, or even we do not have sport clinical psychologist in China. So now we have to rely on the special experts, psychiatrists in outside hospitals or universities to help us. And in the future, I would say in China, we are considering to develop some programs to training our specialists or the clinical psychologists and closely working within or inside in the provincial or the national sports training centers. So probably we can provide some full-time sports clinical psychologists in the future in China. So this is my answer.
Thank you. Thank you. He applauds you. Thank you very much from Paris to Hong Kong. Give him a round of applause, please, from Gangyan Si. Thank you so much.